Raised by fundraisers like CrossFit to Crossout Cancer get spent?
Money raised by fundraisers, and of which the Cancer Center benefits, has many uses. One of the things that's a challenge for us is equipment and buying newer equipment that can help patients both in treatment, in quality assurance practices, as well as symptom management. At the Cancer Center, two or three things that we've been thinking about is a portable ultrasound machine that helps us drain fluids from patients in the most effective way. Also, a barcode reader, which sounds a little bit dry, but it's important in terms of making sure that the right patient gets the right drug at the right time and the right amount. So these are just a couple examples of what we're looking for. Last year, we acquired an ultrasound, an endoscopic ultrasound that helps us locate small tumors adjacent to the large airways. Money's raised in programs like CrossFit to Crossout Cancer is very important in that it allows us to acquire some of the tools, some of the small machines and other gadgets, if I can say, that help us treat patients that aren't funded by our global budget. The province is very good to fund drugs, to fund people, but acquiring technology that can be cutting edge, that can give patients the best treatment closest to home is the kind of thing where we do fall short, and any funds and monies provided by outside fundraising is extremely well received and very important.
Okay. Does new technology have a big impact on patient outcomes and survival rates?
New technology continues to impact patients both in terms of patient experience. And when I say that, I mean getting devices that can do very quick tests at the bedside or at the chair side and have fast turnaround time so people don't have to wait for results of tests. The other thing that new technology is helping us with is imaging. And I refer now to some of the more fancy imaging that we get at diagnostic imaging like MRI, CT scan, and PET scans. Monies to acquire those kind of machines is something that we need to seek, and outside fundraisers such as CrossFit to Crossout Cancer is very important in that regard.
Okay, without fundraisers like CrossFit to Crossout Cancer, what would the impact be on the Cancer Center in your role?
If there weren't outside fundraisers like CrossFit to Crossout Cancer, we would be short. We would be short in a number of devices and imaging tools and other things that help us look after patients, investigate patients, and lead to better outcomes. And so despite the excellent funding we get from the Ministry of Health, there is always a gap, and that gap is met by outside funders like CrossFit to Crossout Cancer. So keep up the good work. We depend on you, and patients depend on you too.
And what is your vision for the cancer program going forward over the next few years?
The Stronach Regional Cancer Center is a comprehensive, large community cancer center that treats most cancers close to home. We are growing. We now have 9 medical oncologists, some hematologists, and about 7 radiation oncologists. This is one of the fastest growing regions in Ontario. And what I see for our center is continuous growth and us quickly adopting the newest technologies and drugs to give patients the best outcome. We're a leader in the province in that regard and will remain such. The other thing that we're doing is growing our clinical trials program to give even earlier access to cutting edge medications that may be available.